And we are live. It's Dr. J here in the house. Excited to have my little live Q&A session here today. Again, we'll dive into some coronavirus updates and any other questions on immune boosting, any other health topics, feel free. Before we do, make sure you smash that like button. It really helps. Trying to help lots of people this week. If you haven't subscribed to this channel, make sure you do. Hit the bell so you get notifications and put down your comments below. What are you doing right now to boost up your immune system? What's helping you? What's not? Let me know. All right, y'all, so what is happening today? So I did a video I posted this morning on some of the statistics. Not looking too good in Italy. I mean, we know that. But again, in general, people in the mainstream media saying 10 million people are going to die. Not even close. We'll go look at the statistics. Right now, under 3,300 people in China have passed out of a country that's 1.2 billion. That's going to be the equivalent of 800 people passing in the United States. Now, I don't think China did a great job reacting to this. One, they live in tight, kind of close quarters. They have a lot of open animal markets. They waited a month. They covered up the whole entire fiasco. They sent 7 scientists to jail as whistleblowers. So they didn't act early. I think we're on top of it. If you look at the Johns Hopkins website, which will pull up, you'll see everything's pretty spread out. It's not like major clusters throughout the U.S. They're just small little spots, especially in the Northeast, some areas in California, New York City, and some of the urban areas. The Midwest, pretty good. Only one spot in the middle of Texas, right around where I'm at in Austin. Not too much beyond that. Why don't we dive in? So first off, 99% of those who had the virus in Italy had other comorbidities. So again, who's the biggest risk factor? 60 and up, comorbidities, other diseases. These are the people that want to quarantine. Quarantine, hydration, vitamin C, good clean proteins, quarantine. I've said it earlier, why did Italy get hit big time? Well, number one, they did not close their borders to China. Italy has the largest amount of legalized Chinese citizens. And I think there's actually some Wuhan-related factory businesses in Italy. So there's a lot of flow back and forth between China and Italy. Didn't close the borders. Number two, a lot of multi-generational people living in the same household. So grandkids and parents potentially bringing home infections that their grandparents may get. Again, when your grandparents live alone or they're more isolated, well, they can quarantine a lot easier, right? And then, of course, number three is more smoking, more respiratory issues, and the average age of, I think, passing was 80 plus. So keep that in mind. Also, 99% had a disease. So if you are that person, quarantine. Everyone else, social distancing, I think is reasonable. No one is talking about boosting your immune system. Yeah, we know there are some good things with some of these drugs that are out here today, the chloroquinolone and the combination of the azithromycin, right, the chloroquine or the hydroxychloroquine and the azithromycin combination right here, you can see is shown to be very effective at knocking down the virus. Is this fixing anything? If it's knocking down the infection, that's great. It's not going to be boosting your immune system, though. So best thing we can do is boost the immune system if we have some palliative things like this that can help. Now, why is azithromycin helping? It's an antibiotic. It has anti-inflammatory benefits. So I think a lot of the lung inflammation that's happening, the azithromycin is actually helping to reduce a lot of that inflammation. Now, you're much better off, in my opinion, fine, have that, but boost up your redox pathways, right? Your redox pathways are very important. They're the pathways that provide glutathione and vitamin C and all these powerful antioxidants. They essentially give off electrons to help with free radical stress, and they provide a lot of anti-inflammatory support and reduce inflammation. So glutathione, vitamin C, N-acetylcysteine, our vitamin A, our powerful antioxidants are going to help with those redox pathways, give off electrons, help with free radical stress and inflammation. So if you have options for a drug, fine, but boost your immune system in the meantime. Again, if you are doing a drug, take a look at the side effects, right? Guys, here's the chloroquine side effects, pretty nasty. Allergic reactions, hives, liver problems. Also, look, fever, chills, sore throat. Kind of sounds like the flu, doesn't it? So if you are going to go that direction, talk to your doctor. Make sure you're monitoring for these side effects because they could happen to you. And again, if you want to do the combo like this study shows right here on the screen, right? The green line was the azithromycin and the chloroquinone. And guess what? The chloroquine, it did phenomenal. So keep that in the back of your head. If you want to go do the combo option, it's there for you. I know Trump is fast tracking a lot of these things, and they're already approved medications. So your doctor should be able to prescribe off label for you now if you need it. If you have a family member who's at that higher age, maybe stock up on it, but do all the immune boosting stuff too. We talked about Italy. So what's happening statistically with Italy? Well, not the best. They're still a week away, like I mentioned, from, I thought maybe they had a little drop yesterday. You can see yesterday they were 427. The day before that, they were, I think, 475. So they had a little pullback. I thought they were going to round that bell curve, but not yet. Not yet. So they're up to 627. When we look at Italy here, you can see, see here, this is United States. Let me go to Italy. When we go to Italy, you can see here they were at 427, a little pullback, and now they're at 675. So they're way up here today. I'll make this a little bit bigger so you guys can see this. Okay, so you can see right here that they're way up here today. So that bell curve isn't quite rounding. What we're looking for is this. We're looking for this bell curve to round right here. Again, China is about 4 weeks ahead of us, so we're looking for this pullback right here. This pullback and then things to flow back down. This is the bell curve. Again, Italy got hit hard. We already talked about why they got hit hard. But this progression seems to be lasting about 2 months. 2 months. You can see here South Korea pull back a little bit faster. I mean, they were at 7 yesterday. They're at 2 today. So if you run the trend, they're curving down here. They're curving down. And then if you look at their disease incidence, I mean, they're pulling back. I mean, look at that. It's just pulling back big time. Again, don't freak out with a lot of disease incidents because a lot of them, a lot of the testing are 50 to 80% false positive, incorrect. So you may get a lot of incorrect numbers on that. So when you look here at the new cases, right? New cases are going to go flying through the roof. Well, some of that is true new cases. Other of that is just, hey, people are now getting picked up. And remember, there's an 86% asymptomatic rate. What does that mean? That means that for every one person that gets the infection, at least 7 to 10 of them are going to have the infection with no symptoms. So keep that in the back of your head because that makes the risk factor look a lot less. Now, here we are in the U.S. The U.S. may be having a little bit of a pullback today, which is good. They may be rounding. I think we're still a week away based on the curve, okay? Based on what we saw in China. China rounded out here in about mid-February-ish, so about 3 to 4 weeks in. So I think we're another week away from rounding that off. So maybe another week or two of social distancing and quarantine. Probably at least 2 weeks of quarantine if you're 60 and up, for sure. Maybe another week or two of social distancing. We'll have to just see what the government officials say. So you can see that there. And then if we look at... Yeah, so United States here today, they're at plus 30, okay? Plus 30, and if we look at where they were yesterday, they were at 57. So we're pulling back to here. We're pulling back to like here where my cursor is. So we'll see if that continues to pull down or not. Hopefully we pull like a South Korea. And then let me kind of come back down to here as well. So statistically, should we be worried, guys? Well, I mean, Italy, what's happening in Italy isn't good, right? It's definitely above and beyond, but let's compare it. Let's look at flu. Let's look at the whole world globally. 23,000 people die of flu a year. 231,000 confirmed people through testing, and then 1.13 million are estimated, right? So we have this many people tested, 1.13, 231,000 confirmed cases, but they estimate out 38 million. So 38 million are estimated. They run statistical regression analysis to figure out how many people in the whole country got it based on the 1.13 million in a certain region, and then they can project out. So remember, if we run the stats off of the 231,000 getting it and the 23,000 dying, that's a death rate of 10%. Right? That's inflated because we don't know the total incidence. Once you run the regression analysis, it's 38 million. That brings the death rate down to 0.1%. That's how the statistics work. With coronavirus, we're not doing that, all right? We're not doing it because we don't have enough data points. We don't have that 1.2 million data points. And the test is wrong bloody 50 to 80% of the time. That's what the stats are saying, what the studies over in that are already being released are saying. So when we look at that, even with the inflated rate, not knowing the true incidence, and we know it's at least 7 to 10 times more than where it's at now, it's at 1.1 And if we know the true incidence is at least 7 to 10x above where we're at now, well, guess what? That drops the death rate down to the flu death rate. But we know it's not even that, because we know the flu kills about 500 people a week, and currently we have 240, 230 in 3 weeks. So we know something doesn't smell right. And if we look globally here, 8,272. So anyone that's saying we got a pretty long way to go from 8,272 to 10 million. We're just not even close. 206,000 confirmed cases through testing. Again, we need at least, based on the global size, I'm going to guess we need at least 5 million to 10 million data points to project the whole world. If we need about 1.1 million data points to project the entire U.S., and the U.S. is what, like 5% of the world, right? 6.7 billion divided by 327 million, that'll get you your answer. 6, 9. Yeah, so I want to say like under 5%, maybe 4 to 5%. So we need a lot more data points to figure that out. And that came back to 4% there. So we didn't even do a regression analysis. Let's say that 86% is correct. So it's going to be down, 0.2, 0.3, far below the 3.4% the World Health Organization said immediately. So my concern here is that these statistics are inflated and they're throwing people into hysteria and they're not using their frontal cortex. So I don't think it's as bad based on the numbers, based on the CDC data. And we have to compare it to flu. Flu is true context. People say, well, we have passive immunity for flu every year. We have vaccines for it. Okay, well, if 30 to 40,000 people die a year and we have vaccines for it, you're saying it'd probably be much worse if we didn't, right? So it sounds like if flu's killing more than corona so far and we have vaccines for it, then flu's even more deadly, right? Because it would kill even more people theoretically if we didn't have the vaccine. Now, let's not forget the vaccine's 80% incorrect because it's based off of Asia's flu strain from the previous year, and it's wrong 80% of the time according to data. So just want to give you a little dose of reality, guys. I chatted earlier today about natural cures. We can go talk about it in the Q&A. Again, vitamin C, amazing at helping to boost your immune system. And again, let's take out the word cure. Natural immune boosting compounds, right? There is no such thing as a cure, so to speak. Only medical drugs can cure things, right? From a med legal standpoint, but we can work on boosting and supporting your immune system. So vitamin C is excellent here. I'll make this a little bit bigger. You guys don't have to see my mug. Vitamin C, again, really boosting up the immune system. Vitamin C in mega doses appear to relieve cold and flu symptoms, which is great. We talk about this. Vitamin A helping to reduce pneumonia and improve immune function as well, which is great. NAC really helps to boost the immune system and decreases viral replication. Again, NAC inhibits viral replication, which is excellent. And I did a whole video on this morning, guys, so feel free. And you can watch that again in real time. It's up on the YouTube channel, youtube.com/JustinHealth. Make sure you subscribe. And again, this medication, chloroquine, it's a malaria drug, right? Malaria is a bloodborne parasite. So a lot of side effects here. I'm not saying don't use it. I'm glad we have things to put in our tool belt as an option to use if we need. But just know there are a lot of side effects, and some of those side effects are flu-like side effects. So you may feel worse if you take it. And again, it works by actually decreasing. It works by actually decreasing. Try to find it here. Here it goes. I'm not finding it. Anyway, here it is. It works on inhibiting folate synthesis, and that folate is used to replicate your DNA and RNA. So they're using the medication to inhibit folate, which then inhibits the replication of the RNA of the virus. So not the best thing to be on that long term, but if it's for a season and for a reason, right, dealing with this whole corona thing, then maybe it makes sense. But definitely chat with your doctor. Know the side effects ahead of time. All right, any questions, y'all? Let me know. What's going on? What's on your brain? Any health topics, I'm here to answer today. Best herbs to use for parasite infection, dosage of these herbs, and how long to use them, best food and supplement for hormone support. Oh my gosh, that is a loaded question if I ever saw one. Depends on the infection. Again, you can go justinhealth.com/shop, click on my gut clearing herbs, and there's different protocols that I have, GI Clear 1 through 6, and I have other special orders that I do for different infections ranging from Giardia and Blasta to Cryptosporidium to H. pylori to Clostridium. So there's a whole bunch of different infections, and those protocols change. There is no just one size fits all. How long to use repairing herbs like aloe vera, licorice, slippery elm? Oh man, those are just, it's too loaded of a question. But in general, typically anywhere between a few weeks to a few months, depending on what's going on. I'll typically test for gut inflammation markers, like we'll look at calprotectin or IgA levels. We'll maybe test zonulin for gut permeability. You may just look at symptoms, right? Gut irritability, gastritis, acid reflux, all those things matter. We want to look at everything. Okay, here. Congratulations on your videos. Would you mind sharing your thoughts on a brand new cod liver oil which contains little mercury, lead, and calcium? Cadmium. Yeah, I mean, I love cod liver oil. I take 2 grams a day. I use Nordic Naturals. Nordic Naturals and Carlson's are the big brands to use for cod liver oil. They're testing it. It's going to be really good quality, high vitamin A, good K2 levels in there, good essential fatty acids. I like it. Those are my brands there. Heard that the virus attaches to the ACE receptor site. Could you talk more about it? Yeah, so you have the coronavirus. It blocks to the ACE receptor site. That's the same receptor site that the angiotensin converting enzyme docks in, right? So the medication, the ACE inhibitor drugs that you hear about that lower blood pressure, those drugs come in there, and then it blocks the enzyme that takes angiotensin to angiotensin. It blocks the pathway, I think, from angiotensin to renin, and that increases blood pressure, all right? And that increases vasoconstriction. So blocks that. It's that drug that blocks that pathway that then lowers blood pressure, okay? And so you have a coronavirus, small little circle thing. On the outside parts of the membrane are like these little clubs, and those clubs are essentially, they're like corona-like clubs, and they actually come in, they stick onto the cell receptor, and they use that ACE receptor site, and they shunt in RNA from the actual virus inside the cell, and that RNA starts to replicate. And the replication of that RNA can trigger an immune response, and then you start to have more cytokines and interleukins come out, and that's what triggers a lot of the initial symptoms before the virus kind of takes hold. So the whole goal is being healthier, having healthier cell membranes and really good epithelial tissue and stronger macrophages and such and natural killer cells. It's going to be harder for that coronavirus to even dock on board, where healthy cells, healthy immune response, that cell just comes in there and bounces right off you. It doesn't even have time to use that ACE receptor channel and shoot that DNA inside of you. So the healthier and the more your immune system is boosted, the less chance you're going to get infected. And again, just no one's talking about immune boosting. Okay, got it. Quarantine, that's social distancing, that's all like avoidance, right? It's like avoidance. But what can we do proactively to upregulate our immune system? Like one side of it is like, don't stress your system. But the other side is, well, how do we upregulate it and make it stronger? Two sides of the same coin, both really important, but it needs to be discussed. With vitamin D3, is it best to take in the morning? I would. I mean, vitamin D is made from the sun typically. So if you're making a hormone that's typically produced by the sun's up in the morning, or in the afternoon, take it then. Is ascorbic acid an adequate vitamin C supplement? I mean, ideally, I'll use ascorbic acid with bioflavonoids or L-ascorbate, which is reduced with bioflavonoids or buffered minerals in there as well. I like that. Edwin writes in, Doc, thank you for your videos. I was curious if you have a list of immune-boosting vitamin supplements, and I can rewatch the video and take notes. Yeah, so go take a look at the video here again. Ginger, by the way, is awesome. Just get ginger root, juice it, hot water. I have a video on YouTube on how to do it. Hot water, 16 ounces of hot water, whole lime squeezed in there, tablespoon of honey. And check this out. Ginger has lots of antiviral effects. Retroviral nausea, virus herpes, common cold, which is usually a rhinovirus, influenza A. I mean, God, ginger is like amazing. I love ginger. And it's a natural vasodilator too and anti-inflammatory. So gotta love the ginger. Okay, where are we at? Are there natural treatment options for post-antibiotic C. diff? Yeah, I mean, we may want to kill it with some clearing herbs. I like GI Clear 4 in my line for that, and I'll combine that with Sacroflora. We'll do like 20 to 30 billion a day for sure, and that really helps a lot. You got to address everything else in conjunction with that, though. Constant phlegm, cough, doing nasal rinse. If you can't get a hold of the glutathione or silver, do you suggest anything to nebulize? The nebulizer arrived. Yeah, you could do some silver. You can nebulize silver. I would be doing N-acetylcysteine if you don't have access to glutathione internally. You can at least take NAC. I'd be doing sinus rinses at least 3 times a day. I'd be drinking ginger as well. And make sure that if you can get the Neti Xlear, that's going to have the xylitol in there, which is antibacterial, antifungal, so that will kill whatever's in there. Keep flushing it out. And then you can also do shots of apple cider vinegar, which will, the acetic acid will strip any of the mucus that's hanging out in your throat. Great questions. Started bone broth powder fast last week while in New York. Didn't do extra vitamins or electrolytes. Got home from DC, feel great, but terrible skin rash on the back of the hands. First step to correct this. It depends. So what do you think caused it? Is it like an atopic dermatitis from something like an eczema, or is it like contact dermatitis from like some kind of irritant you touched? What do you think? First thing I always go to is food. So get your food all cleared up and see how much that does it. If you ate some bad food or some bad drink, maybe that's it. If not, I would get that dialed in first, see how much that moves the needle, and then keep an eye on it. If you need more, there's some other things that you can do. I like a product called Mother of All Creams that helps with psoriasis and eczema. I like that one. Depends what it is. If it's eczema, we may want to look at a moisturizer, but get the food cleared out. That fixes so much. Is it true that spreadable diseases are less fatal? I mean, it just depends, right? Like you have diseases like SARS and Ebola. Like Ebola kills 40% of the people that it gets in contact with. But the problem is it doesn't spread well. Same with SARS. SARS didn't spread well. SARS killed a lot of people too, but it didn't spread well. So it seems like just based on past history, the more infectious diseases tend to not spread as much. They're not as contagious. But the flu is really bad. People downplay the flu. The swine flu is terrible. It's even worse. Avian flu is awful. There's avian flu right now in the homeless population in Los Angeles. No one's talking about it. I mean, it's crazy. Unbelievable. Those are the people that are going to be the most affected, people that have really poor health already. They live in really poor sanitation. They don't get access to adequate nutrition or clean water. I mean, they're going to be the ones most affected along with the senior citizens. I mean, I've heard things where they're going to get them off the street, which they should, but we'll see if they go willingly. It'll be interesting. Cross your fingers. Spreading of vitamin A and C through tomatoes and potatoes, really good minerals and vitamins, but higher in carbs and lectins. Yeah, potatoes are really great for vitamin C. More for vitamin potassium. So vitamin A and C. I mean, any of your green vegetables, your leafy greens, any of your berries are going to be great. So lean on your lower sugar fruits, lean on a lot of your leafy greens to get those. You won't really get much vitamin A. You'll get a lot of beta carotene that may convert to vitamin A, but vitamin A is fat soluble. You're going to find it a lot more in animal products. You'll get a lot of the beta carotene precursors, but not as much vitamin A per se. How does obesity affect COVID-19? Well, people that are obese tend to be insulin resistant, and we talked about insulin resistance has a major impact on your macrophages, and that affects phagocytosis, which is how your macrophages engulf and invaginate viruses and digest them. So the more insulin issues you have, the less you're going to be able to utilize phagocytosis. Skin rash above was a ring in the ear that started as well at this point towards something. Yeah, so if it's a ring in the ear, so meaning like you were wearing a ring and that the ring touched your ear and made it worse, sounds like more of a contact dermatitis thing. Got any idea if sports leagues like NBA could potentially return sooner? Most media is being very skeptical about it. It's tough because what's happened is it was like a virtue signaling thing for people to like just close everything down. I mean, you had like early on when people were closing things down, you had like 20 deaths. We got 400 people dying a week, 500 of flu right now. There's one hospital in upstate New York right now that has over 100 people in the hospital sick. And guess what? Not one has corona, they're all flu. So flu is a big deal, yet media and society has not ever reacted like this to the flu. So to overreact like this on the sports side of the fence, it is what it is. I get it. Fine, let's give us a 2-week buffer. Let's social distance. Let's quarantine. And let's see if we can get a little more sanity, hopefully maybe the end of next week. Fingers crossed. I would think in the next week or two, they could at least bring this thing back and play without crowds, at least that. But we'll see. Best big toe fungus Vanager. Thoughts on why it will show up? That depends on why. It could be gut issues, could be topical issues, like you walk around with sandals all day, or you're in a locker room. I have an herbal toenail fungus soak. If you go to justinhealth.com, shop, just type in toenail fungus soak. That works good. And there's some really good fungal pens that I use that have like chitin in there that are just amazing. They work really good. What can I do if I'm battling Lyme disease? I also have mold toxicity, MCAB, which is, I think that's, what's that? That's the histamine issue with the monocytes, right? Or the mast cells. Mast cell activation disorder, I think, right? And breakouts and painful hives. It just depends. I always start with the foundation. So much of mold and histamine issues and Lyme could be other things. Again, if it's mold, like you actually have tests in your house of high levels of mold and tests in your urine of high levels of mold, yeah, that's an issue. The question is, what's the right order of addressing it? So I always get the diet dialed in, get the hormones dialed in, get the nutrients dialed in, fix digestion, then go after gut infections. 80% of the immune system is in the gut. So if you get the gut working better and you take the stress off the gut, the immune system gets stronger, and that'll deal more with detoxification and mold stuff after. There's got to be a good order of operations. And again, I've done full hour-long podcasts on that topic, so take a look at that so you can get more intel. What's better, NAC or glutathione? I mean, NAC is going to be cheaper and easier. NAC is good. If you have access to glutathione, that's even better. And if you can nebulize it, especially with weak lungs, it could be even better above that. Dr. J, any thoughts on Ben Lynch's one-off remedy for symptoms of a viral infection? It's 100,000 IUs of vitamin A, vitamin D, a vitamin A, and 50,000 vitamin D, 50 milligrams of zinc. Is that too strong? Apparently very effective. Yeah, that would, I think, be really good. Just be very mindful if you are pregnant or trying to get pregnant. That level of vitamin A would be very teratogenic and could cause birth defects. So if you're a woman, make sure you are not trying to get pregnant or are pregnant. But yeah, I think that's very effective. Yeah, I mean, I would typically add in reishi or medicinal mushroom in there because that's very powerful at bumping up your immune system. Where can I go to view the charts of your posted stats? Yeah, so all these stats right here, y'all, this is going to be worldometer.info. This is all pulled from the World Health Organization. And guys, if you look right here, there's a link. See the URL? Right there, Worldometer. And then I just keep it all. I have all the windows up on my computer, and I just refresh them. Right? So Italy, not looking good. China, looking awesome. USA, looking better today. We'll see if it keeps. And South Korea looking better today. So I'm just keeping an eye on a couple of countries. Oh, also really cool site. John Hopkins site. COVID map is awesome. Just so you can see and kind of get a perspective of where everything's at. And things aren't really things are a lot of gaps on the map where people aren't infected. You can just see everything's really concentrated in a couple different areas. Let's see. Here we go. So we just click United States. Where are we? China, Germany. There we go. US. Here we go. 221 deaths. And we just zoom in from here. Yeah, because you can see here I am in Austin, right? Boop, only one. That's it. A little bit Louisiana, Midwest, just a little bit in Kansas, not much. A little bit in Colorado. Big spots. North. This is where like literally this one nursing home, I think it's like life extension or life, I forget what it's called, something life nursing home. I think with 35 deaths right there alone. Okay. Some spots in California, not a lot in LA, surprisingly. Right here, mid California, Central Valley. And then of course New York, bigger urban areas here with the exception of Central Valley, Philadelphia. So pretty cool. So you can see all the deaths. Washington State, right? Literally 1/3 of all these deaths are in Washington. Oh, by the way, cool studies are out. I talked about it like a couple days ago. Virus is definitely sensitive to humidity and heat. So humidity goes up, heat goes up, the less time the viral can live and spread. So that's actually one thing in our favor. As temperatures get warmer, it's excellent. Okay. Any other questions, y'all? If we were to keep the sugar down, what do you suggest as a replacement for bronchial syrup because they are loaded with honey. Well, a little bit of honey is okay because the honey can smooth things out. I'm not just don't do a lot of it. Just keep it down. So you can do elderberry. I mean, elderberry has more sugar in it. If you have a vegetable glycerin, that's fine. I do a ginger tea, and I use about a tablespoon of honey for this whole thing. But I'm just sipping it. It's more medicinal. So as long as you're keeping your carbohydrates down overall, you're going to be fine. But yeah, there's different ones that are out there that have stevia in them. You could also, in my line, just do the Amino Supreme, and that has some of the elderberry, which is the Sambuca nigra. That's in there too. Ringing in the ears, not on my ears. Tinnitus, blood sugar at 83, ketone reading 0.6, and skin rash maybe, starting some activated charcoal. Ringing in ears. So it could be an autoimmune thing. Hashimoto's has a strong association. I need to do a full history on that, how that even happened. Could be structural, like you banged your head. Does it get better when you? Are there any otolith crystals in there? When you flush them out, it feels better. Post-concussion stuff. Need to do a full history on that. Could untreated sleep apnea put one at risk for developing more serious complications from COVID-19? Potentially. I mean, if you're not oxygenating and you're not getting good rest, you could be a little bit more compromised immune-wise. So, I mean, if you have sleep apnea, get the inflammation down. At least start with a solid paleo template, anti-inflammatory foods, low toxins, and nutrient-dense foods. So more vegetables than fruit, healthy organic fats and proteins are going to be the way to go. How much glutathione or NAC? 1 gram of glutathione, 2,000 milligrams, so 2 grams of NAC or 1 gram of glutathione. Can any of the supplements or herbal recommendations you have interfere with diabetes or high blood sugar, pressure, or cholesterol medications? Not that I'm aware of, but I mean, you always double check with your doctor to be sure of that. I mean, I can't just give you a catch-all, but there should be no complications with diabetes, blood sugar stuff. There should be no complication with high blood pressure or cholesterol, but double check with your doctor. I mentioned a lot of things, so we're getting quarantined here in Albany, Georgia. Yeah, makes sense. I think social distancing, especially if you're 60, 65 plus and you have any comorbidities, definitely full-on quarantine. Social distancing is still great as well. Go with that. I think it's smart. What's the difference between glutathione and reduced glutathione? Reduced has an extra electron. So it's just supposedly more activated. Like you get glutathione, your body has to then reduce it by cleaving off an electron. If you take regular glutathione, if it's reduced, it has an extra. So it has to add an extra electron to it to make it more active. So there's an extra step it has to go through. Doing nebulized rinses, trying to clear the phlegm, and doing everything you suggest, but trying to find a solution to the coughing, getting to the point, sometimes uncontrollable. Yeah, so ginger. Ginger is an anti-tussin effect. It will decrease the cough. Keep flushing out your sinuses. A lot of times those chronic coughs can be post-nasal drip. Basically, a post-nasal drip is a runny nose that's down the back of your throat, and it just irritates the cilia and causes a cough. So keep flushing the sinuses out. And utilize ginger, and then worst case, if you need some kind of like a paralytic to chill it out so it's not as bad, fine, but try to do the natural stuff. Ginger is amazing. Great. What's your suggestion to help with sleep apnea? My husband has it and he doesn't like his CPAP. Yeah, get the inflammation down. So do all the things I just mentioned a minute ago regarding diet. What are your thoughts on liposomal vitamin C versus ascorbic acid? Liposomal is good. Buffered C is also good as well. They're both good. I mean, some people say the vitamin C liposomals absorb better. Maybe it could be fine. If you're doing high quality vitamin C that's buffered, you should be fine as well. All right, excellent. Any other questions, y'all? Hope you guys enjoyed today's Q&A. If you did, thumbs up, give me a share, put your comments down below. Sharing is caring. Really appreciate you guys getting the word out and getting everyone informed, right? We don't want to have hysteria. We want to use our frontal cortex, right? Cortisol surges will suppress our immune system. Let's be smart. Let's use our brains. All right, guys, you have a phenomenal day. Great chatting with you. Enjoy the weekend. Maybe I'll sneak back on here in a little bit. All right, take care.